NJENGA, Acting CEO of Population Services Kenya. I'm a public health professional and privileged to have worked within the healthcare space for the last 16 years in this country. And I currently work in Population Services Kenya, where we work towards improving the health of Kenyans. So what Population Services Kenya is, we are a local non-governmental organization, and we come to support the government of Kenya towards improving the health of Kenyans. We empower Kenyans to make healthy choices. We realize that the burden of healthcare is so big, and there's no one entity that can really solve or work by itself towards improving the health of Kenyans. So we join hands with the government, with other partners, including the private sector, distributors, manufacturers, other NGOs who are in this space, development partners, donors, and other players who are interested towards improving the health of Kenyans, including grassroots organizations,
yes,
community-based organizations, and also counties as well towards improving the health of Kenyans.
Pretty much. Somebody want to ask you this question. For how long have you been in existence within the Kenyan space? And you now, to the point that you're now the acting CEO, is that a journey that you can report? You're looking back to and saying, well, I'm proud to be associated with a PS Kenya because of this particular journey that I've seen myself.
Yes. So PS Kenya started as Population Services International in this country, and we've worked for the last 30 years in Kenya. We've been working towards measurably improving the health of Kenyans. In 2013, we were registered as a local non-governmental organization.
Yes.
And the reason for changing or shifting this strategy towards becoming local is because of the realization that there's local expertise, there's local knowledge, there's local talent that can be utilized towards improving the health of the local community. Solutions that are locally grown are known towards being more impactful and also changing lives in a sustainable manner.
Yes.
So within PS Kenya, and what we are very proud of is the changes that we have seen in this government and how we have seen healthcare improve. We might not be where we want to be, but we have seen a lot of improvement. Let me use the example of reproductive health and family planning, which is a component of the work that we do, where we work towards educating mothers, educating communities on the importance of really owning up and taking up responsibilities for their own reproductive health measures. So what we do is that we educate women and young communities and also the entire environment towards having healthy choices and taking up healthy choices. Let me give you an example of an adolescent girl. You'll find an adolescent girl or even a young woman who is not 18 yet, but they have 3 children. So how we come in is that we go directly to the communities and we educate this young woman about what choices, because nobody else in this country has gone to talk to her and tell her about what options exist within the government, what is there, especially for women who are out of school girls. We walk with them that journey and ask them, what do you want to be? What are your goals? What are your aspirations? What are your needs? Where do you see yourself in the next 5 years, the next 10 years? And this is a very tough question. You should see the look in the faces of the young girls when we ask them this question. Nobody has ever asked these young people about where do they want to be in the next 5 years, because they're used towards working day by day in the local community.
Yes.
If they're married when they're young, they know what their daily attributes or what they need to do every day. They go to fetch water, they take care of their young ones, they are servants to their partners as well. And that's what the culture has been. So what we do, especially and working within the confines of the law and within this government, we partner with the local county governments, we partner with health facilities, we train healthcare workers on measures of family planning, and also we directly talk to these girls, the youth, about the options that they have towards accessing reproductive health services.
Yes.
So we let them know you can access different contraceptive methods. The choice is yours. So we give them the power. These are the options that are available, and you take the choice. It is up to you. How do you want to to space your pregnancies in a timely way, in a healthy manner, so that by the time you're getting your next child, this child has grown is about 4 or 5 years, and you have enough time to take care of each of these children. You remember when you were younger, some of us grew up in big families with 8, 10 children. And parenting was very different in those days because it was mass production and there was a lot of mass care for all the children in that house. So to improve the quality, and we've seen there has been advancements. Looking at the data, earlier last month, the first month of this year, the national government released the Kenya Demographic and Health Survey Report 2022.
Yes.
And it showed that child mortalities have reduced, under 5 deaths have also gone down. So the quality of life has improved. There are less children who are dying. We have not reached the target yet, but there are less. So the chances of survival of a child right now and 30 years ago is much higher. And that also translates to the children that we should be bearing. And we give that power to the communities so that they can better decide what exactly they want for themselves.
Yes.